We're joined this morning by Steve Skrivanos, chairman of University Health System Board of Managers. Accurate?
That is accurate. A pleasant good morning to you, Aaron. How are you?
Doing good. Last week, F. King Alexander, the LSU system president, said that, we were in a financial crisis, in a big mess, and could be closing our doors within a year. How'd you react to that, firstly?
Well, first, as a citizen of North Louisiana, let me say this. I believe that the LSU School of Medicine is perhaps the most precious asset that we have in North Louisiana, certainly in Shreveport, and there is nothing more near and dear to my heart than the School of Medicine. Even though I'm the chairman of the board of University Health, that's just kind of how the cards came down. The School of Medicine is incredibly important to us. It is an untapped economic engine, and it's critically important to us. So I want to do everything we possibly can to support the School of Medicine. So let me start with that. But he went on to say from the Board of Regents, and he implied that the problems that were going on now, the economic problems at the School of Medicine, were somehow the responsibility of University Health.
Yeah, y'all were paying bills funny. There was some issues.
That's correct. And, of course, we had the press release that we released yesterday that addressed some of that. But let me just frame some of this and just put it in terms of perspective. The amount of invoices that were at issue was about a little bit less than $5 million, which sounds like a lot of money, but in the overall scheme of things, we paid the School of Medicine in the state nearly $400 million since all that started. So that is not a huge sum of money in relative terms, in terms of the total amount of money that goes between the partners. But somehow, Dr. Alexander went on to say that because of this $5 million problem, and it's for erroneous invoices, we spelled it out, it's for physicians that have been terminated, it's just stuff that was just incorrectly billed. We're current on everything else. He was somehow trying to say because of that, and we're slow paying those invoices, that they were required to draw down $40 million on their line. And so I listened to all that, and so we went to work. So we went and gathered all the data that was informed 3 graphs that really are sort of the central issue that's defining the healthcare crisis in North Louisiana at this moment.
Mm-hmm.
And we found out that beginning in 2011, that LSU, the School of Medicine, had about $270 million or so in their total funds balance. And then beginning in 2011, that fund balance has decreased to where today it shows to be a little bit less than $50 million on the most recent amount of information that we can find on the website. So there has been a hemorrhage of cash of $200 million that started long before the Biomedical Research Foundation was ever involved in this at all. So if you look at the chart, and it's going to be part of the public dialogue here very shortly, in that period of time, the funds balances at the Shreveport campus had been going straight down long before we ever got involved. So when we got involved in October of 2013, LSU told us 2 things. They said, first, and they said this on the record in testimony in front of the Joint Budget Committee in Baton Rouge, that if we paid LSU $48 million in professional services fees, that they would be able to balance their budget. It's on tape. We cited we got the video on our press release. And just a little background on that $48 million. I spent the summer of 2013 when I stepped away what I was doing as an oil and gas producer, working with Dr. Hugh Mighty, then he was the vice chancellor of clinical affairs at LSU. And we crafted what we felt were reasonable business models that would fund the medical school and the hospital because both needed to remain solid. And so, given that, Dr. Mighty came to us 60 days later and said, I made a tragic mistake. The $48 million is not going to cover it. We're going to need closer to $100 million.
Mm.
And so we said, well, and knowing that the medical school is incredibly important to this area, I said, well, if either of us is going to struggle, I would rather it be the hospital struggle than a School of Medicine. So we at that point in time doubled their $50 million request to $100 million, and we paid that $100 million, from the partnership moving forward. And so given that the campus was hemorrhaging cash long before we got involved, and given the fact that we are now paying the School of Medicine $50 million more than they testified was necessary to balance their books, the crisis may exist on the campus, and certainly the funds balance exists, indicates that it does, but it is hardly the responsibility of the safety net hospital. What I would argue, without our additional $50 million, that curve would look a lot worse than it does already.
Steve, let me ask you, let me
was,
ask you this, Steve. Steve Skrivanos, chairman of the University Health System Board of Management. There's some
kind of going on here, but given the $50 million extra that we gave LSU, they earned for services. We didn't give it to them. Their doctors were providing services payments. But given the additional $50 million that we were able to pay for services for LSU, and the budget still isn't balanced, that's a state problem. It should not be incorrectly thrown on the back of the safety net hospital, who is paying for professional services at twice the rate that they initially said would balance their books.
Are some folks in South Louisiana really, as we've heard from former Mayor Cedric Glover and others, are they really trying to shut this down to move this med school to South Louisiana?
You know, there are various conspiracy theories floating around here, but let me tell you this. These are facts. Let's just talk about the facts. I don't want to get into all that. The solution to this problem is really pretty easy. So when all the privatization occurred, as it turns out, of all the safety net hospitals, the University Health has saved the state, by the state's own numbers, $100 million since our 10-year of operation, while delivering more medical services to the Shreveport and North Louisiana communities, including our sister partner in Monroe, than has ever existed, while saving the state $100 million. So I was born in North Louisiana. Chances are I'm going to die here. I think that it's fair for North Louisiana to recoup some of that $100 million savings to backstop the med school until we can figure out, as a community, what needs to be done to fix it. So that, to me, is the solution. North Louisiana has saved the state $100 million. Some of that $100 million needs to come up and prop up the med school at this point in time.
Steve Skrivanos, chairman of University Health System Board of Managers. Can we get you to come in studio where we can spend more time with you later this week?
You betcha. Well, my schedule's pretty hairy. I'm going to be getting out of town. I'll see what I can do, and we can talk about this once we get off the air.
We'll do it.
Yes, I'd be delighted to do that as soon as my schedule can.
Need more time for you, definitely.